In liver, we'll discuss mainly the anatomy, the tumors, the abscess, and the hydrated cyst. So initial few questions will be based on the anatomy. That is the most important part of it. Now, anatomy is technically a bit complex. Liver from outside it looks a well organized, smooth organ, but inside it's technically complex, right? So I will try to simplify the liver anatomy for you. Now, the segmentation of the liver is based on the triads, the portal triads, right? You must be knowing the three structures going to the liver: the hepatic artery, the portal vein, and the bile duct. Hepatic artery and portal vein are carrying blood to the liver, and bile duct is taking bile out of liver. So these are the three structures at the liver hilum. Now each of these structures divides into branches according to the lobes and the segmentations. Each structure will have one branch for each segment, except one particular segment. We'll discuss it, that is segment 1, which is autonomous segment. So each segment will have its own branch of portal vein, its own branch of hepatic artery, its own branch of bile duct. Okay, so this is called portal triad. Okay. Now the first is following is the image of Connard segments. Now segmentation of liver was done by Connard. So accordingly these are called Connard segments. Which of these segments is marked by the arrow? Now the easiest way to remember this, you can remember it in two ways. The lobes, right lobe and left lobe, right? Or just consider it in terms of clock. Okay, so 2, 3, 4, 5, 6, 7, 8. So this is the division: right lobe, left lobe. Okay, I hope it is clear. 2, 3, 4 are in the left half. Total segments are 1 to 8. One is separate. Though anatomically, embryologically, one is a part of left lobe. So indirectly you can say 1 to 4 is left lobe. It's easy to remember. 5 to 8 is the right lobe. 5 to 8 falls in the right half of the clock. So they are part of right lobe. 2, 3, 4 part of left lobe. Right. Now 2 is on the top. Right. So 2 is on the top. So 2, 3, 4. So will rotate in the clockwise manner, right? So say this is the division, right and left. We'll talk about it in subsequent questions. First focus on how do you identify the segments. So this is the left lobe. So 2, 3, 4. So start from the top. 2, 3, 4 clockwise fashion, right? So segment 2, segment 3, segment 4. Right? Easy. 2, 3, 4. Now 5 is at the bottom, 2 was at the top. So that's another way how to remember. 2 is at the top. So we start from here, 2, 3, 4. But 5 is at the bottom, 5, 6, 7, 8. So here the nomenclature of right lobe segments will start at the bottom. So 5, 6, 7, 8. Clockwise manner. So both the segmentation left lobe and right lobe, you have to follow the clock. And since 2 is at the top, so we'll start from here for the left lobe, 2, 3, 4. And for the right lobe, because 5 is at the bottom, so we'll start with the bottommost, that is 5, 6, 7, 8. So this is how we do the segmentation. So the arrow is marked at segment 8. So answer is segment 8. I hope it is easy now for you. You will never forget this segmentation of liver, right? Okay, so this I have already told you, right? Again, left lobe 2, 3, 4, and that's the right lobe 5, 6, 7, 8. Okay, now let's see the further question. This is about the division. So before the segmentation, we should divide liver into two halves. Now there are two ways of dividing the liver. One is the anatomical division, one is the surgical division. So anatomical division is done by the falciform ligament. All of you know the falciform ligament. It's a peritoneal fold attaching liver to the anterior abdominal wall. It's a remnant of the umbilical vein, obliterated umbilical vein, right? So if you see liver, so that's a falciform ligament. So falciform ligament forms the anatomical division of liver. It's not surgical. Anatomical division, right lobe and the left lobe, right? So the falciform ligament divides liver in what kind of, so this is anatomical division. Now surgical division of liver is done by a line known as Cantlie's line. Now this is very, very important. Lots of questions asked about Cantlie's line. The angle, how do we form the Cantlie's line, and how does it divide liver into right and left lobe. So this I hope is clear, the falciform ligament, right? Now this one shows both the division. See, this is the liver and that's a falciform ligament, falciform. So this is anatomical division. Now this is the Cantlie's line. It has been curved in this. You can draw a straight line, Cantlie's line. Now Cantlie's line, it's 75 degree to horizontal, to the horizontal. And it's a line joining, if you see this green structure, this is gallbladder and this is IVC. Normally it is on the left side of the IVC, gallbladder to left of IVC, and more precisely it is middle hepatic vein. I'll have a diagram, a picture I'll show you. Middle hepatic vein, right? As you can see here, this is the middle hepatic vein. This is the gallbladder. So this is Cantlie's line. This is Cantlie's line. Okay. Line joining gallbladder to the left side. This is IVC, left side of the IVC, or the middle hepatic vein more precisely. Okay. Now what is the difference? This is the falciform ligament. Now the difference, you can see the difference. Anatomical division, segment 4 is in the right lobe. The left lobe is only segment 2 and 3. But in surgical division, segment 4 is in the left lobe, right? Even the segment 1 as it has been shown. We'll talk about it separately. Just focus on the lobe division and the segmentation. So just 3 things you have to remember here amongst the first 2 questions. Anatomical division of liver is done by falciform ligament, where the left lobe is segment 2 and 3 and right lobe is 4 to 8. But that's anatomical. Surgical division is by the Cantlie's line, which is the line joining the gallbladder to the middle hepatic vein, or IVC if you don't have this choice. And that divides liver into right and left lobe, where the left lobe is segment 2, 3 and 4. Whereas right lobe is 5, 6, 7, 8. So again the clockwise, 2, 3, 4, 5, 6, 7, 8. So that completes a clock. Clear? Okay. And the segmentation, you should know the marking of the segments. Okay. Now about the segment 1. Now segment 1 is also called caudate lobe or Spigelian lobe. So first of all, you should know the alternate names. There is one more name used, is quadrate lobe. Quadrate lobe is the term used for segment 4B. Segment 4 is further divided into 4A and 4B. Now the segment 4B, which is right behind the gallbladder. In this picture you can see segment 4A and 4B. This segment 4B is right behind the gallbladder. This is called quadrate lobe. So you should know these alternative names. Okay. Now segment 1, this is the posterior side of the liver, behind the liver. The segment 1 is not present in the anterior surface. It's behind the liver, embracing the IVC. As you can see, this blue structure, that's IVC. This is segment 1.